Hello everyone, welcome to Yellow Pages Nursing. In today's video, we will be discussing about nursing implications for diagnostic tests, under which we are going to discuss bone marrow aspiration and biopsy and the responsibilities of a nurse. Before entering into this session, if you have not subscribed our channel, please subscribe our channel and do not forget to hit the bell icon to receive instant notifications. Let's get into the session. What is bone marrow aspiration? It is a procedure that involves taking a small amount of liquid bone marrow through a needle. And bone marrow biopsy is a procedure that involves taking a sample of solid bone marrow tissue using a special needle. And as we all know, bone marrow contains cells that produce white blood cells, red blood cells, and platelets inside large bones such as spine, hips, skull, and long bones of axial system. Now, what are the indications of bone marrow aspiration and biopsy? It is indicated for diagnosis or staging of diseases or response of treatment like leukemia, multiple myeloma, lymphoma, anemia, thrombocytopenia, and Pancytopenia. It is also indicated to monitor the development of hemolytic disease and response towards the treatment given. The other indications include hematological disorder, fever of unknown origin, lymphadenopathy, metastatic tumour, and disseminated tuberculosis. Let's discuss about the Contra Indications. And this includes hemorrhagic disorders such as congenital coagulation factor deficiencies, example hemophilia, disseminated intravascular coagulation, allergic to anesthesia, skin infection at the sampling site, bone disorders such as osteomyelitis or osteogenesis imperfecta. Now, here are the articles needed for a bone marrow aspiration procedure. It includes bone marrow aspiration tray, bone marrow aspiration needle, that is Jamshidi needle, sterile gloves, surgical gown, face mask, aspiration needle, povidone solution, injection lignocaine, syringes, that is 20 ml, 10 ml, and 3 ml, needle 18 gauge, heparin saline, dynaplast, heparin vacutainer, gauze piece, surgical blade, micropore, formalin, and glass slide. Now, what we see is the commercially available kit for bone marrow aspiration and biopsy, which contains all the articles needed for the procedure as we discussed before. Let's discuss about the site and position for bone marrow aspiration and biopsy. Position of the patient depends upon which bones are used to obtain the bone marrow samples. In adults, iliac crest, either posterior superior iliac crest or anterior superior iliac crest, is chosen, or the breastbone or sternum is chosen. In pediatric, tibia crest is chosen for babies under 1 year. The patient is asked to lie on their abdomen, that is prone position, or on their side, that is lateral decubitus position. Now, let's look into the nursing responsibilities before, during, and after the procedure. First is before the procedure. Ensure that the consent for the procedure is obtained. Ask the client to void before the procedure. Check the vital signs and record the same. Position the patient as discussed before. Check the coagulation profile of the patient. Inform laboratory technician because bone marrow is smeared immediately on a slide. Perform hand hygiene and wear appropriate personal protective equipments. Assist the doctor in injecting local anesthesia to numb it and increase the patient comfort during the biopsy. A small incision is performed over the intended biopsy site. A bone marrow aspiration needle is placed in incision site and the surgeon uses a syringe to withdraw a small amount of liquid bone marrow cells through the needle. The procedure includes using a specialized hollow needle. A bone marrow core is removed. Once the core bone marrow sample is withdrawn, apply pressure at the biopsy site with gauze to stop bleeding. This usually takes around 5 to 10 minutes. A sterile dressing or dynaplast is applied to the biopsy incision site. Nursing responsibilities during the procedure includes helping the patient to remain in appropriate position, monitoring vital signs during the procedure, and assisting the doctor for the procedure. Nurse's responsibilities after the procedure includes applying sterile dressing over the puncture site, place the patient in appropriate position, observe the site for bleeding, monitor the vital signs, documentation of the procedure and patient comfort level, make sure the sample are sent to laboratories, proper disposal of biomedical waste, replace the articles, and instruct the patient not to do heavy activities. Complications of bone marrow aspiration and biopsy includes long-lasting discomfort at the biopsy site, bleeding, infection, and fever. This is all about today's video regarding nursing implications for diagnostic tests, that is bone marrow aspiration and biopsy, and the responsibilities of nurse. If you find this video useful, please like it and please subscribe it, and do not forget to hit the bell icon to receive instant notifications. Thanks for watching and have a nice day.